All right, we are going to get started very shortly. Allow me to share my screen, and we are off. Based on the symptoms presented, the best diagnosis for Diney is schizophreniform disorder. Diney exhibits delusional beliefs, including being followed by foreign governments and having secret information about the CIA. These are all examples of persecutory and grandiose delusions. Donnie's refusal to hug her parents, along with uneasiness and lack of recognition of her own home, suggests disorganized behavior and a significant change in her typical personality and social interactions. The symptoms have been present for approximately 4 months, but 2 months short of the 6-month duration required for a diagnosis of schizophrenia, a differentiating factor. A drug test ruled out substance use as a cause for her symptoms, eliminating a substance-induced psychotic disorder. Her parents' concerns, her friends' observations, and her general odd behavior indicate a significant decline in her functioning. The symptoms of delusions and disorganized behavior are present, fitting the criteria for schizophreniform disorder in the DSM-5. Based on the current information, schizophreniform disorder appears to be the most fitting diagnosis. Her symptoms align with the criteria of this disorder, which include delusions, hallucinations, disorganized speech, disorganized or catatonic behavior, and negative symptoms lasting for at least 1 month, but less than 6 months. Brief psychotic disorder is less likely due to the longer duration of her symptoms and lack of full remission. Professional views on the psychopharmacology of schizophreniform disorder are complex and multifaceted, largely because of the disorder itself as a diagnostic crossroads. It is treated as an initial acute psychotic episode that may or may not evolve into a chronic condition like schizophrenia. The core psychopharmacological issues, therefore, revolve around the urgency of treatment, the choice of medication, managing side effects, and crucially, the duration of treatment. The most effective treatment for a condition like Donnie's would likely involve a combination of medication to manage acute symptoms and psychological therapies to help her and her family cope with the condition and prevent future relapses. The medical model views psychological disorders as diseases with biological causes. It assumes that the presenting symptoms are a result of an underlying biological or physiological dysfunction. The psychological model, in contrast, sees schizophreniform disorder as the result of psychological, social, and environmental factors. It emphasizes the role of a person's life experiences, thought patterns, and coping mechanisms. Key symptoms suggest a potential diagnosis of a psychotic disorder, most likely schizophrenia or a related condition. The selection of an atypical antipsychotic is justified based on the neurobiological understanding of the disorder, dopamine dysregulation, and the therapeutic goals of symptom reduction, improved functioning, and a favorable side effect profile that supports long-term adherence. Her delusions and paranoia could stem from an overassignment of meaning to irrelevant stimuli, possibly due to excessive dopamine activity in the mesolimbic pathway and disruptions in the prefrontal cortex and limbic system. Her altered social interactions, odd behavior, and uneasiness with her parents align with negative symptoms and impaired social cognition involving areas like medial prefrontal cortex and amygdala. Elevated cortisol and HPA axis dysfunction are common in early onset psychosis and are linked to symptom severity. This suggests the stress of college could be a contributing factor. Based on the information provided, it's highly probable that Donnie is experiencing a psychotic episode with symptoms pointing towards schizophrenia or a related psychotic disorder. The agent in this case is not a drug, as the drug test was negative, but rather the underlying neurobiological and psychological processes that are causing these symptoms. Antipsychotic medications would directly address the underlying neurotransmitter dysfunction, leading to a reduction of her psychotic symptoms and a subsequent improvement in her behavior. The biggest hurdles are noncompliance due to a lack of insight and paranoid delusions, side effects of medication, which can lead to further noncompliance, and difficulty engaging in therapy due to paranoia and cognitive symptoms. A successful treatment plan would need to proactively address all of these limitations. In conclusion, the initial use of an SGA for Donnie represents an evidence-based and professionally endorsed course of action. Its predicted effectiveness in managing delusion and paranoia is high, particularly given new onset nature of her illness.